If you are worried about having a hair transplant, but worried that the results may leave you looking kind of unnatural with plugs or that unsightly scar on the back of your scalp, you're definitely going to want to check out this episode. I'm Dr. Mina. Welcome to my channel, The Skin Real, where I give people real skin education and information so that they can make informed decisions about their skin health. Sound good? Let's get into it. This is my weekly recap episode where I break down my key takeaways from my most recent episode with Dr. Ross Kopelman. He is a hair restoration surgeon in New York City and Palm Beach at Kopelman Hair Restoration, and he is going to be sharing with us so many pearls on what to know before, during, and after you get a hair transplant, and if it's even right for you in the first place. If you want to hear the full episode, be sure to stick around for this short episode, and I will link it at the end. I have done a ton of episodes on hair loss because people are so concerned about it. Men, women, I find it is really pervasive and it starts a lot earlier than people realize. I didn't think I was going to have to worry about hair loss, but I did notice some thinning around my temples and my part seemed a little bit wider. And this happened in my early 40s. So this is something I find that men and women and really anyone 20 plus can struggle with. But is a hair transplantation right? Well, it's definitely not the first thing you're going to want to seek out if you are struggling with hair loss. And here's why. Because you need to first be on medical therapy. And even Dr. Kopelman, who is a hair transplant surgeon, recommends this. And essentially, he says to not even get a transplant if you're not going to be on medical treatment because it is so important. You can think of the medical treatment as being the fertilizer. It is going to make the transplant more successful, the odds of it working, and with even better results. And so it's imperative to sort of make the soil for the transplant as fertile as possible. And you do this by medical therapy, by taking either a DHT inhibitor, oral medication like minoxidil, topicals, PRP, mesotherapy, things like that. And it's important that if you aren't on them, that you start and you stay on it really indefinitely. Dr. Kopelman likens it to getting Botox, right? If you stop doing Botox, you're going to stop getting the benefits of it. Same thing with the medical therapy for hair loss. If you stop, you kind of go back to your baseline. It's not going to be worse, but it's not necessarily going to be better. And so you really do need to be on it. Now, there are two types of hair transplants that you can have. The first one to come out about 15 years ago was a follicular unit transplantation, an FUT for short. This is where they take a strip from the hair at the back of your head, which tends to be the most robust. It can hide the best, and it's less sensitive to hormones that can make hair thin. And a strip is taken, and then those follicles, those hairs are then implanted where you want them to be, whether that's the part, the vertex of your scalp, your temples, your eyebrows, wherever you are looking to have hair. And at least in my opinion, I felt like this was the old outdated way because I have seen scars that people have on the back that is more noticeable and is kind of a telltale sign that you have had a hair transplant. And then a more recent technique was developed called the follicular unit extraction. And this is where they individually extract hair follicles to then transplant them. And it may sound like, well, this is better, it's more natural. But actually, Dr. Kopelman shares that for women, this may not be the better option because they're going to have to shave a much wider surface area to get 1,000 plus follicles versus if they just took a thin strip, say on the back of my head, my hair would cover it, you wouldn't notice it, and I'd never have a scar. So it's not that the FUT is out of date and not useful. In fact, Dr. Kopelman really advises that in some instances, that's really the better option. But those are kind of your two basic options. And ideally, the person you're seeing for a transplant is familiar with both of those, and they can help you decide which one is best. Certainly, FUE is a more popular one now. It's the newer one. About 74% of hair transplants are the FUE technique. But I love how Dr. Kopelman says that it's not always the case. And really, if you see a surgeon who is skilled at both, then you'll probably get better results because they are just a one-trick pony. They're only going to do FUE for everyone. Instances like women, the follicular unit transplantation may actually be the better option. Now, I was really intrigued for women having transplants, which I couldn't believe there were that many women having hair transplants out there. But what Dr. Kopelman shared is that a lot of these women are having eyebrow hair transplants, which totally makes sense as someone who grew up in the 90s and early 2000s when we totally overplucked our brows and shouldn't have done that. So, women actually get transplants a lot more often than you realize, and especially eyebrow transplants. Now, I used to think for women, you would want to keep the hair long and transplant it long, that it would give more natural results. But actually, when you have a hair transplant, the little follicles are planted or embedded in the areas that you want. And they will be there for a couple of weeks, but then those hairs fall out. And it's important to know that those hairs are going to fall out. Otherwise, you're going to think your whole transplant didn't work, it's failed, and that you'll have no success. But actually, with a hair transplant, once those little follicles are embedded, the hairs will fall out. The little seeds or the follicular bulbs are still in the skin. And over the next 6 to 9 months is when you start to see that new hair regrowth. Now, it does start short. And if you're a woman or have long hair, there is going to be some time for it to grow out, that it may be a little more noticeable. But that's why whether you transplant a long hair or not is really less important, because those hairs are going to fall out anyways. One of the most important things about having a hair transplant is the design phase, because it's not just about removing the follicles and doing it in a very precise, meticulous, careful way, which is huge and critical. And this process can take 6, 7 hours. It can take all day if you're doing a large area. But the design is also super key, that the person doing your transplant is paying attention to how your hair falls and curves. Where do you part your hair? Things like that are critical, making sure that if they are bringing your hairline forward, that it's a shape that looks natural and that you are happy with. So the design phase is also critical for a successful hair transplant. So you don't look like you have lots of little plugs all over and hair growing in all different directions. Now, like I said, the transplanted hairs do fall out. It's important not to get discouraged, and it's important to stay on your medical therapy. Whatever prescription medications you're taking, topicals, any in-office procedures like PRP and mesotherapy, these are key and super important to continue on, because even when you don't see any signs of that hair growth, it's like planting a garden. You are getting that soil primed for amazing hair growth, and you'll have better results if you do that. Then after about 6 to 9 months, that's when you start to see the hair regrowth and the success of the hair transplant, which is really phenomenal and exciting, but it is playing the long game. It's not a quick fix. Now, who would be a good candidate for a hair transplant? Well, men and women can both be candidates for hair transplants. It's important that you have sufficient donor hair. So you need to have enough hair at the back of your scalp to be able to extract enough hair follicles to make it look natural and to cover all the areas you're looking to fill. That's number one. And number two, if you are in your 20s or 30s, especially as a male, you're probably too young for a hair transplant. And Dr. Kopelman mentioned this because we don't quite know how your hair loss journey is going to go. Whether you are someone who is going to lose all the hair, lose that back area, or are you someone who can stabilize with medication? So he actually doesn't recommend men in their 20s and 30s to get hair transplants, to actually wait until you're more in your 40s, 50s, and 60s to seek treatment, which is a little different from things like PRP, where we say start to treat immediately. If you are noticing hair thinning, or your spouse is in their 20s or 30s, then that's the perfect period to get them on some medical therapy, get them started with some in-office treatments. People who have an actual hair disorder are not good candidates for hair transplants either, or have a medical condition in their scalp. So scarring alopecias, that can happen. Things like lupus of the scalp would be better suited with other medical management. And autoimmune conditions like alopecia areata would not be great candidates for hair loss. And this is, again, why it's important to see your dermatologist and your hair transplant surgeon if they're not the same person, because your dermatologist can help determine whether you have a true hair condition, what kind of hair condition. If you are someone who is pulling your hair out, that would not be a great option unless you do have counseling, or unless you are under the care of someone for that, because you don't want to just pull out your new transplant. So there are conditions, medical conditions, where a hair transplant would not be advised. So again, with most procedures, and you've heard me say this before, don't look for the best deal. Look for someone who's truly an expert in this, who can diagnose what's going on, what kind of hair loss you have, would you be a good candidate or not, and can be honest with you and help get you on, again, that medical therapy first, because you're going to need that to maintain your results, whether or not you go through with that hair transplant or not. Biggest takeaways from my interview with Dr. Kopelman is that you should do your research. Go to your appointment with your hair transplant surgeon educated, informed. You know about the different types of extractions, whether it's the FUT or FUE. You've maybe watched some videos. You are coming to the table educated, knowledgeable. You know what questions to ask and what concerns you may have. Number two is not to skip medical therapy. This is so, so key. Hair transplants are expensive and it takes time. And if you're going to invest that time and money, you want to get your best results. So being on medical therapy is key for optimal results. And then number three, managing your expectations. I know every hair transplant surgeon would love to be able to promise that you're going to have thick, beautiful hair, even if you never had, or return your hair to what it looked like when you were 16. But that's not really realistic or possible. And so just making sure that you have realistic expectations so that you're not disappointed, again, after this long journey of a hair transplant. If you want to hear my full episode with Dr. Kopelman, I highly recommend it. You can check it out here, and I will see you next week.